I'm Dr. Yeager. I'm a psychologist in private practice, and I hold an appointment as Associate Clinical Professor in the Department of Psychiatry, UCSD School of Medicine, where I have taught for the past 25 years. After reading the work of James, the Watsons, Passagioli, and others, I began to formulate an explanation for mental functioning that satisfied my need for understanding, and that explanation evolved into the psychotherapeutic procedure I call subliminal therapy. This course is a presentation of that procedure. It is a procedure based on a model of the mind that is not conventional. A few therapists have questioned the credibility of this procedure. You may also have questions, yet bear with me. What I offer is persuasive. Prior to my career as a psychotherapist, I was an aerospace engineer. And although no longer qualified as an engineer, I still think like one in many ways. And the concept of subliminal therapy grew from the engineer's way of thinking about the world. Also, I believe profoundly in the necessity for scientific validation. Yet, what if a concept does not fit conventional thinking, and yet nevertheless seems valid? Do we summarily dismiss it as incredible? Or should we maintain openness to the extent of examination? I submit the latter is preferred. Having come upon the model of the mind I will present in this course, I examined it, I tested it, and it proved valid. It evolved into the most efficient means that I know to effect desired change. To enable the therapist to intelligently guide the course of therapy, communications from the unconscious domain to consciousness must be established in ways that are clearly identifiable as such. And it seems that some parts of the unconscious domain are aware of and cognizant of all conscious perceptions. The unconscious domain is taught to communicate to the patient at a conscious level of awareness, thereby providing indications of completed work when a requested step has been accomplished, or to provide requested information. This information, as perceived by the patient, is then orally reported to the therapist. The vehicle of this unconscious to conscious communication can be through any of the senses. However, the use of an imagined chalkboard on which Centrum can write is preferred for pragmatic reasons. Other examples of unconscious to conscious communication include listening to an inner voice, and by the use of idiomotor signals such as coded finger motions, wherein the unconscious is taught to assume control of the fingers and to respond by that means. Even a Ouija board can be employed for this purpose. Communication with Centrum in such identifiable ways permits necessary discrimination between such communication and conscious opinion. This step is demonstrated in the following excerpt from a treatment session. Now, what brings you up to the head of the class here? What would you like to accomplish, Glenn?
I would like to get rid of my dermatitis.
How do you experience this dermatitis? How does it affect you?
How does it affect me? When I'm stressed, it gets extra itchy. It's just this localized spot about this big in the back of my neck, and it just gets itchy when I'm stressed, and it gets inflamed. And when I eat seafood, it's exacerbated. And I like seafood.
And what?
I like seafood.
And you like seafood, okay.
Yeah.
How long has this been going on in your life?
Gosh, I want to say about 5 years. I don't recall exactly when it
But you do remember a time when this was not a problem?
Oh, yeah.
Oh, yeah. Okay. Our theme here is to, first of all, for you to obtain the insight about what's going on, why it's there, and then to resolve it using that insight, right? That's the plan of attack here. And I want to use this technique that I described as subliminal therapy. I will be posing a variety of questions and maybe requests, largely to Centrum. You see, I am assuming, hypothesizing that there is a Centrum over there in that pretty head that has these capabilities that I described earlier. And Centrum has the ability to communicate with you consciously in identifiable ways. The way I'm suggesting that we employ is an imaginary chalkboard. We could use finger signals or an inner voice or many other ways. Okay. But I'm suggesting that that an imaginary chalkboard will be the most effective way. So I will ask that you consciously create an image of a chalkboard, just using your imagination, and then your job becomes that of an observer, consciously. Your role is an observer, and you tell me what gets written on that chalkboard by Centrum. Make sense logically? Whether you believe it'll happen or not.
Yeah, I got it.
Okay. Now, as we do this work, I will be posing questions to Centrum, and when I address Centrum, beginning my question with the name Centrum, just automatically I want you to look on the chalkboard for the answer.
Okay.
Okay? Mm-hmm. Now, when time comes for conscious opinion, and it certainly does, I'll be very clear about that. You know, Lynn, what do you think about that consciously, or something like that? But if I preface it with Centrum, I don't want you to fill in any blanks. If it doesn't say anything, that's what you're to tell me. If it says yes, you tell me yes. Because some of the answers will be obvious. Some of the answers may not make good sense. You may not understand them. And some of the answers you may just out and out disagree with. That's all okay as long as you tell me what the answers are. We'll make progress. Fair enough?
Okay.
You can do that. Okay. So, imagine your chalkboard. Just set up your chalkboard. Got it?
Can I close my eyes?
That's your decision.
Okay.
That's mine. Got the chalkboard? Okay. Now, I request that Centrum, just in demonstration of willingness to communicate this way, I ask that Centrum write the word yes, Y-E-S, yes, there on your chalkboard. Let me know when the word yes appears.
Yeah.
Okay? And now, Centrum, are you aware of your conscious concern about this dermatitis? Centrum, are you aware that you are consciously bothered by it, concerned about it?
Yes.
And Centrum, are you concerned about it? Are you bothered by it?
Yeah.
Okay. Centrum, it is your conscious wish to eliminate that. Do you, Centrum, support that conscious wish to eliminate that dermatitis reaction?
There's nothing on there.
Okay. Centrum, do you agree that it would be good to eliminate that dermatitis? It's in your best interest to eliminate it? Do you agree that that's so, Centrum?
No, I can't read it.
Now you can't read it? Ah, okay. Centrum, does some part of your mind want that reaction to continue? Does some part of your mind want that dermatitis?
Yeah.
Uh-huh. And does that part of your mind believe that it is in your best interest for that to continue?
Yeah.
And does that part of your mind believe that it's serving some purpose in your life?
Yeah.
Doesn't make very good sense, does it, Len? See, we're
No.
not talking about really rational process in terms of current perspective about things. Okay, here's the next question to Centrum. Centrum, is it okay for you to know consciously why that part wants the dermatitis to continue? Would it be okay for you to understand this consciously, Centrum?
It says no.
Why would it say no, huh? Is it Centrum? Do you, Centrum, understand why this part is causing this dermatitis? Do you understand why that's happening, Centrum?
I read no.
I'm sorry, what'd you say?
No.
It says no? Okay. Centrum, are you in communication with that part that's causing the dermatitis? They're in the unconscious domain. Are you in
Yes.
communication with that part? Then, Centrum, please engage in communication with the objective of learning why. You see, Centrum, that part came into existence, developed in some situation at some time in your life when that dermatitis kind of reaction, whatever it was, when that was when that made sense, when that was productive, when that served real, actual purpose. Now, in your present life, it doesn't appear to make very good sense, but that part of your mind that's causing it is still acting on the basis of what was, probably in ignorance of what is, probably in ignorance of present life condition. So, Centrum, please communicate with that part to learn, to understand the position that that part holds. You see, Centrum, that part is well intended. It's using its influence in your best interest as it understands your best interest. Investigate, Centrum, find out why. And when you've completed that investigation, let us know that you have completed it by writing the word complete there on the chalkboard. And then it's your job just to tell me when the word complete appears there on the chalkboard.
It's being written.
Okay? Centrum, do you now understand why that part is causing the dermatitis?
Yeah.
Centrum, do you believe that it is in your best interest for that to continue?
Yes.
Centrum, do you now believe that that dermatitis is serving useful purpose that should continue to be served?
There's nothing on there.
I'm sorry?
There's nothing on there.
Okay, let's be patient just a moment longer. Please consider that, Centrum. Is some purpose being served that is real, that is an actual part of your life, and that
No.
oh, okay. Then, Centrum, is it now okay for you to know consciously what that purpose was?
Really big no.
Says no?
No.
Okay. Centrum, do you want that dermatitis to continue? Do you, Centrum, want that reaction to continue, to be a part of your life?
No.
And Centrum, you don't consciously want it, you don't want it, and yet is there still some part of your mind that believes it should continue? Does some part of your mind still want that dermatitis to continue?
Yeah.
Then, Centrum, please communicate further with that part of your mind. You see, Centrum, if one person wants to persuade another to his way of believing, to his perspective of things, person A is advised to find out where person B is coming from, why person B believes what they believe and what they believe and all about it, and then on the basis of that understanding, perhaps persuade that person to a different way of thinking, to a different conclusion. So I'm asking you to use that philosophy, Centrum. I want you to communicate with that part, to develop a full understanding of that part, and include mutual understanding, such that that part understands your position as well. And then on this basis, educate that part about let that part become aware of the negative consequence of its influence. Let that part become aware of the reality of your life as it is today, the needs and values and life situation that you hold today. Educate that part in that way. Persuade that part to your way of thinking, Centrum. Please accomplish this to the limit of your ability, and when you have done so, let us know again by writing the word complete there on the chalkboard. Lynn, you just let me know when the word complete appears.
I see it.
Already. Okay. Centrum, were you successful in persuading that part to your way of thinking?
Yes.
Okay. Centrum, is it now okay for you to have conscious understanding of what has been going on?
Yes.
Then, Centrum, please provide that understanding now by writing it on the chalkboard, by a memory, by a hunch, by an inner voice, by whatever means is appropriate. Provide that conscious understanding. And Len, you just let me know when you understand it, when it makes sense.
Makes sense.
Makes sense to you?
Yeah.
Is that what you would class as insight, whatever it is?
Yeah.
See, I as the therapist don't even need to know what it was. All I need to know is that you know.
I know, but I don't know if I agree with it.
I'm sure you don't agree with it. It doesn't make very good sense. Do you recognize that it made good sense back then?
Yeah.
Huh?
Yeah.
That does make good sense. Just doesn't make sense in your life today. Is that correct?
Not really.
No, of course not. Centrum, do you agree that it no longer makes sense in your life?
Gee, it says no.
Centrum does not. Centrum said no. Oh, okay. Centrum, just be sure that I phrased my question correctly. Centrum, do you believe that dermatitis is serving useful purpose in your life?
I can't believe I see a yes.
I can believe you see a yes. Centrum, is it okay for you to know consciously what that useful purpose is so that you can understand what's going on?
It said yes.
Okay, then Centrum, please write that answer on the chalkboard. Write words that will communicate to you consciously What purpose is being served?
It says stop eating meat.
Stop eating meat. Okay. Lynn, what is your, I told you a while ago, when the time came for your conscious opinion, I would ask for it, and now I'm asking for it. What's your conscious opinion about that, your conscious reaction to that?
I'll stop whenever I'm ready.
Seems that you have a little inner conflict here. One part of your mind wants to stop, another part of your mind wants to be defiant. Maybe another part of your mind is damn well determined that you're not going to do that and is going to keep the dermatitis active until you stop it. You understand what's happening?
Yeah.
Reflecting on the demonstration just presented, you will notice that the basic steps of subliminal therapy were followed. I first ensured rapport, then guided Lynn to identify her goal, introduced her to the subliminal therapy concepts, established a vehicle of communication between consciousness and the unconscious domain, that is the chalkboard, and engaged the cooperation of Centrum. I then identified the parts of the mind causing the undesired reaction, that is the rash, and guided Centrum to inform those parts about present reality, thereby persuading them to conform to conscious desire. The process of the foregoing demonstration is only one of many possible ways subliminal therapy can be employed. The therapist is not limited to any particular design and is encouraged to tailor the process to the patient. For example, the therapist may conclude that interacting directly with a given part may be desirable rather than using Centrum as an intermediary. One part may be encouraged to communicate directly with another. Communication between parts may be accomplished without conscious awareness, and the therapist may or may not pursue a given request to accomplishment. Possible variations are endless and the subject of professional judgment. As an alternative introduction to the concept of learned dysfunction, the therapist might explain, "You were not born with the problem you have presented here. There was a beginning, a first time, and the memory of that first experience is probably stored in the unconscious domain of your mind. Centrum has the ability to examine the memory and to learn from it, doing so from the perspective of present, more mature knowledge and understanding, as opposed to the perspective of limited knowledge of that earlier time. The process can then be described to ensure understanding both consciously and unconsciously that the dysfunction or limitation began not as a problem, but rather as a solution to a set of circumstances that were then in effect. Only from the perspective of the present is the dysfunction or limitation recognized as such. At that time, and under those circumstances, the something now recognized as a problem made sense and was functional. The steps are as follows, and will be expanded upon in following discussion. First, define the goal of therapy. Then introduce the concept of subliminal therapy by lecture, as is demonstrated in the video, or aided by having the patient read the introductory booklet on the subject. Then establish communication with Centrum and enlist the cooperation of Centrum. Then request that Centrum investigate the cause of the presenting problem. Then request that Centrum identify those parts of the mind responsible for the current problem. Request that Centrum determine the beliefs of those parts regarding the presenting problem, and request conscious understanding of the positions held by those parts. Then reflect conscious opinion, and request that Centrum communicate with those parts, educating them about present reality, present life needs and values. Affirm successful completion of each step by appropriate questioning of Centrum. Then identify any remaining errant parts by requesting Centrum to investigate the possibility of their existence. Then repeat steps 5 through 12 until no remaining errant parts are identified, and request full conscious awareness of the work just completed. And then finally, test completeness of the work accomplished. It is consistently advisable to define the goals of therapy at the beginning of the therapeutic relationship. The goals are best articulated in a simple expression of conscious desire and should be well thought out and clearly understandable to both the patient and the therapist. Not only does this step afford direction for the therapy, it also affords a measure of effectiveness of the treatment. It seems necessary that the patient have a general comprehension of the process of subliminal therapy. However, exhaustive explanation is unnecessary since the process becomes clear in the course of application. Introductory instruction may be accomplished by lecture or may be more efficiently accomplished by having the patient read the introductory booklet, the availability of which is detailed at the end of this course. To enable the therapist to intelligently guide the course of therapy, communications from the unconscious domain to consciousness must be established in ways that are clearly identifiable as such, and it seems that some parts of the unconscious domain are aware of and cognizant of all conscious perceptions. The unconscious domain is taught to communicate to the patient at a conscious level of awareness, thereby providing indications of completed work when a requested step has been accomplished, or to provide requested information. This information, as perceived by the patient, is then orally reported to the therapist. The vehicle of this unconscious to conscious communication can be through any of the senses. However, the use of an imagined chalkboard on which Centrum can write is preferred for pragmatic reasons. Other examples of unconscious to conscious communication include listening to an inner voice, and by the use of idiomotor signals, such as coded finger motions, wherein the unconscious is taught to assume control of the fingers and to respond by that means. To enable the therapist to intelligently guide the course of therapy, communications from the unconscious domain to consciousness must be established in ways that are clearly identifiable as such. And it seems that some parts of the unconscious domain are aware of and cognizant of all conscious perceptions. The unconscious domain is taught to communicate to the patient at a conscious level of awareness, thereby providing indications of completed work when a requested step has been accomplished, or to provide requested information. This information, as perceived by the patient, is then orally reported to the therapist. The vehicle of this unconscious to conscious communication can be through any of the senses. However, the use of an imagined chalkboard on which Centrum can write is preferred for pragmatic reasons. Other examples of unconscious to conscious communication include listening to an inner voice and by the use of idiomotor signals such as coded finger motions, wherein the unconscious is taught to assume control of the fingers and to respond by that means. Even a Ouija board can be employed for this purpose. Communication with Centrum in such identifiable ways permits necessary discrimination between such communication and conscious opinion. This step is demonstrated in the following excerpt from a treatment session. It's a technique that, as I mentioned, I could have used instead of guiding you just to the specific memories. And I want to introduce you to this technique, and then we're going to use it. I'm going to guide you to use it. You have to do all the work. I'm going to guide you to use this technique as a way to research, to be sure there's not some other active element here that might still upset the apple cart and cause asthma. Okay? And I have to do a little mini lecture here to set the stage for this. I need to talk about my understanding, my theory of how our minds function, how they're put together. It seems that certainly part of our mentality is conscious. It also seems to me that a much greater part of our mental capacity is unconscious. And I want to teach you how to take advantage of unconscious abilities that are not taught in our culture. We don't pay much attention to these kind of things. I believe that our unconscious domain is highly intelligent. It has information that we don't have available consciously. It has abilities that we don't have available consciously. So I want to teach you some things about consciously utilizing some of those unconscious abilities for therapeutic purpose there. It seems that that unconscious domain of our minds is actually not a unified whole, but rather it seems to consist of a great many different parts. By a part, if you learn a new skill, something is there now that wasn't there before. Whatever that is, it's what I'm calling a part. See, a part can represent a skill. It can represent a limitation. It can represent a learned behavior, riding a bicycle or driving a car or walking, or, can represent most anything. But it seems that the unconscious domain is made up of this vast accumulation of different parts that we have accumulated in the course of life. We might call this the mechanism of conditioning. Does that make sense to you logically?
Yeah.
Okay. And it seems that one or more parts of the mind may take a sort of autonomous stand and exert influence in ways that we consciously don't want. We resist, we don't like it, it's a problem. In this model of the mind, I would say that some part of your mind has been causing you to have asthma. Okay? Somebody else, it might cause them to be afraid of the dark or whatever. So our task here in therapy, in correcting this, becomes a matter, first of all, of identifying that part of the mind that's creating the problem, or parts. There may be multiple parts contributing. And then educating them, growing them up, letting them become aware of the negative consequence of their influence. on life as it is now. See, you've heard of Freud, Sigmund Freud. He used to talk about arrested development. That's kind of the same thing, except now we're talking about the arrested development of just a part of the mind. For example, if we put a little girl in a dark closet and just terrify her, it would be very logical that she would learn to associate fear with the dark, and for the rest of her life be afraid of the dark. It would make sense. It's logical. Call it a phobia now.
Right.
Phobias are learned, just like asthma. Well, our task then, you see, is to identify that part of the mind that's still afraid of the dark. That part was arrested. It's operating on the basis of what was, in ignorance of what is. So education, then, you see, becomes the vehicle of change. But to do that, we have to be able to communicate with that part. So we have to have some way of accomplishing all of this. So our mentality now is part conscious, much greater part unconscious. The unconscious is made up of these great many different parts that in general function harmoniously. We do pretty well as humans, but one or more parts may cause problems. Another element of this model of the mind, and that's all it is. Marlene, I don't know how our mind is, just a theory, but it gives us a framework in which we can do constructive things. And the next element of this theory is that to explain how all of these parts, most of them at least, function harmoniously, that says there has to be something in the way of communication going on. Otherwise, they'd just be off in their own directions. It'd be chaos. Well, it seemed to me, and I just hypothesized this to be true because I couldn't explain it any other way, that there has to be some other entity there in the unconscious domain, an entity that's able to provide direction and purpose and communication, an entity that more than one of my patients have referred to, well, that's my soul. Okay, fine. However you want to think of that entity, just for convenience sake, tag on that entity. I call that entity centrum. And I did this many years before the vitamins came out. Centrum. I presume right over there in that pretty head is the centrum. Now, centrum is intelligent. Centrum has the ability to learn, and that's a big part of intelligence. Centrum has the ability also, I'm sure, but we'll be checking it out, but I'm quite sure that Centrum has the ability to remember things that have happened, and Centrum has the ability to communicate with other parts of the mind. Now, if all of this is true, being able to communicate with Centrum and persuade Centrum to cooperate to work in these ways, that would be a really valuable skill to have. And it turns out that that's possible. Communicate. See, I presume that Centrum is listening to me right now. I believe the Centrum hearing me. The problem is getting some communication in the other way, in the other direction, because it hopefully needs to be identifiable so that we can tell the difference between that communication and conscious opinion. Because conscious opinion hasn't solved the problem. So we need a way of differentiating. There are several ways we can do that, but in fact, communication of this kind is not an unusual phenomena at all. As a matter of fact, it happens every time we remember anything. For example, if I ask you, how do you spell cat? Well, you know how to spell cat, but that wasn't on your mind before I asked the question.
Right.
Well, if it wasn't on your mind, where was it? You know, you're pretty well forced to conclude that, well, it wasn't conscious, therefore it must have been unconscious somehow. And I asked the question, and the answer was communicated from the unconscious domain of your mind to consciousness. Now, we don't normally pay any attention to this process, but in fact, we can be aware of it. It happens through our senses. A sense of sight, a sense of hearing, a sense of taste, a sense of touch, you know, through our senses. So you just be introspective for a moment. And let's see, how do you spell cat? Now there's the answer. How did that answer come for you? You see the letters? Did you hear the letters? I've even had people tell me they feel them. I don't know what they mean by that, but I didn't argue. How did it come for you?
I could hear him.
You hear them. Mm-hmm. Yeah, I would guess that you learned to spell cat by hearing the letters. Somebody else would learn, who learned by seeing them, would see the letters in their mind's eye.
Right.
Okay? Pay attention now. Maybe, let's see if you can identify the voice. How do you spell cat? Whose voice is it? Recognize it?
I know.
Hmm?
I don't know. I think it's me.
You think it's your own voice?
I think it's me, yeah.
Okay. Okay. Fascinating, this isn't it? So far here, this is fascinating. Okay, so through our senses, this is how it all happens. And we're going to use a preferred way to perceive these communications through the sense of sight. I want you to create, consciously, on purpose, just create an image of a chalkboard and then be curious to see what Centrum writes on that chalkboard. Okay? Got your chalkboard?
Yeah.
Okay. I ask that Centrum, your Centrum, indicate willingness to communicate this way by writing the word yes. Y-E-S, yes, they're on that chalkboard. Just let me know when the word yes appears.
Okay.
Okay. Now you might say to me, well, yeah, but you know, I can imagine a chalkboard with yes on it or no on it or anything I want on it. I can change it, I can erase it, I can do whatever I want to. And of course you can. But when Centrum communicates, it's somehow different. Probably you'll find that you can't even erase it, for example. Is the word yes still there?
Mm-hmm.
Try to erase it. Still there? Okay. Give you another little experience to validate the process here. I ask that Centrum, your Centrum, now select a different word to be written on that chalkboard. I'd like this word to be a surprise to you consciously. A word that you will know full well you didn't think that one up and put it there. Centrum, please select such a surprise word and write it on that chalkboard. Got it?
No.
Okay, just be patient a moment.
Okay.
Centrum, is my request clear to you? Please answer that question by writing the answer on the chalkboard. Centrum, is my request clear to you?
Yes.
Okay, then please select that word, some word that will surprise you consciously, and write it on the chalkboard.
No is the only word I can think of.
Is that written on the chalkboard?
Yeah.
What's the word?
No.
No? Are you satisfied that you didn't consciously think up that
Why?
word and put it there?
But I tried to pick another word besides no.
Well, I want you to be aware of what you just said to me. I was trying to consciously think of another word, okay?
Okay.
See, the whole key here is that this becomes a way to differentiate between conscious Centrum. Give us an off-the-wall word, a real surprise word, please. Got it? Something written on the chalkboard?
Yeah.
What's written on the chalkboard?
Impossible?
Impossible. Okay. Are you satisfied that you didn't consciously think up the word impossible and write it on the chalkboard?
Pretty sure.
Pretty sure? Okay. That's a unique one. Okay. See, I'm just doing this to kind of validate something different is going on here. This is not normal awareness.
Right.
There's something really different going on here. To guide you to use this technique, I must ask questions and pose requests to Centrum for response on your chalkboard. Now, I can't see your chalkboard. I have to depend on what you tell me is there. And so it becomes absolutely necessary that you tell me what's on the chalkboard, not what you think should be there. Most of the answers will be obvious. It'll say yes or no or whatever it says. You'll know that's right. Once in a while, you'll likely get an answer that doesn't make sense. Once in a while, you may even get an answer that you just out and out disagree with consciously. It should be mentioned that although it is possible for the therapist to communicate directly with identified cooperative parts of the mind, Centrum is usually able to accomplish this communication more efficiently and to accomplish identification of the parts as well. Also, Centrum can communicate with those parts that are unwilling to reveal themselves to consciousness, sometimes doing so even without conscious awareness of the communication process taking place between Centrum and the part. Although there are exceptions, Centrum is consistently supportive of the therapeutic process. It is nevertheless possible that Centrum may hold a viewpoint opposing the consciously held desire or objective. In this case, it will be necessary for the therapist to function as an intermediary, guiding the process of communication toward mutual understanding between the conscious domain of the patient and Centrum, to the end of agreement between them as to the objective of the therapeutic work. Having established communications with Centrum, and with the cooperation of Centrum enlisted, it is usually advisable to ensure that Centrum has the capacity to access memory and to communicate with other parts of the mind. This assurance is obtained simply by asking Centrum if the capacities are present. Centrum is then requested to use those capacities to conduct an investigation in which those parts of the mind that are involved in the presenting problem are identified. Following identification, Centrum is asked to communicate with those parts with the objective of understanding their values and motivations in causing the present dysfunction. Additionally, Centrum is asked to review memories of related experiences when the present problem originated. As a guide to the timing of the process, Centrum is asked to indicate completeness of each task by writing the word complete on the chalkboard or by other means such as a coded finger signal. Having identified the errant parts and having learned from them the reasons, the objectives, and the values held by those parts, Centrum is requested to elevate that understanding to a conscious level of awareness. Assuming compliance, the therapist is then advised to interact objectively with the patient to determine conscious perspective and opinions regarding the information just obtained. Assuming agreement with conscious opinion, Centrum is then asked to communicate further with the errant parts, educating them with the objective of enlisting their support in making the desired change. In the event conscious awareness is denied, the therapist is then advised to investigate the reasons for the barrier to awareness. This is best accomplished by interaction with Centrum to identify the part of the mind that is blocking communication and to learn the reasons for the blockage. Given that information, and by aid of education and persuasion from the therapist, Centrum will likely be able to engineer the desired conscious awareness. Protection of the patient, that is, self-protection from the supposed trauma of knowing, is the most common basis for such barriers to conscious awareness. Note that this process of uncovering unconscious information, evaluating that information from the perspective of mature understanding, followed by re-education of the offending parts, forms the core of subliminal therapy. And this is true whether the work is accomplished at a conscious or at an unconscious level of functioning. The consequent spontaneous reframing of the uncovered material is requisite to accomplish the consciously desired goal.